Erika Branch. And Erika is Executive Director at the Parkinson Support Centre of Kentuckiana. I love that name. But, Erika and her team have been working on a buddy program for some time now, getting people with Parkinson's together with medical researchers early on in their careers. I think it's a wonderful double whammy. You get the people with Parkinson's benefiting with the medical students working alongside them, and then the medical students may well take a career and continue in the Parkinson's program. So over to you, Erika.
Yes. Let's see, we may be able to. Good meet. Thank you all for having me, and I'll make this quick, and so we can have our questions and then break. But I'm here to discuss the PD Buddy Program, and it's a collaboration between the Parkinson Support Center, which is my nonprofit, my being the executive director, not the University of Louisville, the medical school within the University of Louisville, and then also the College of Education. And so there's two different departments within U of L. And then also Kentucky One Health, which is our local hospital system. And so just before we get into the objectives, just to kind of give you a little bit about the program, we pair Parkinson's patients who are identified between Kentucky One Health and the Norton hospital system with first-year medical students from the U of L Medical School. And so we are fortunate to have the partnership with Dr. Catherine Lefevre, in that she plays a dual role. She is a facility or faculty within the medical school, but then she's also a movement disorder specialist. So she has access to the patients, and then she also has access to the students. And so we are very fortunate to have that role built in. Just to kind of also explain the role between the College of Education. Because we're dealing with the university, we had to prove that this program was worthy of the time for the medical school. And so we actually have a researcher that volunteers her time, and she is the one that leads our focus group in a lot of the surveys. And so that's just an understanding of the roles that we play within this program. But the objectives are to impact the patient's social connections and decrease the sense of isolation that occurs when they're impacted by Parkinson's disease. And then for the students themselves, hopefully it will increase their knowledge of Parkinson's disease. And ultimately, the goal would be to get them into a role of neurology or somewhere within the movement disorder field. And so, again, we like to think of it as a double whammy, and that the person with Parkinson's is being benefited from the program, but then also the medical student. The methods by which we do this, it's two tracks. And so as a Parkinson's organization, I handle a lot of the interaction with the patients, and then Dr. Lefevre handles a lot of the interactions with the medical school. So on the patient end, we give a pre and post survey on the attitudes of Parkinson's. And that looks at depression and do you feel isolation, those types of things, and then also a PD questionnaire. And so those are questionnaires that have already been established within the Parkinson's field. And so we didn't have to recreate the wheel with those. And then there's 3 focus groups that are managed by Dr. Catherine Lefevre. Again, she's the researcher with the College of Education. I will mention that her husband has Parkinson's, so it's not as though we're paying her to do this. She's truly just volunteering her time and has a general interest in Parkinson's disease itself. But the focus groups, we do one before the program starts, and for the patients, again, it's really just trying to manage their expectations of the program. How much information would they be willing to share? Going into it, you may have someone that says, well, I'm not comfortable to talk about so-and-so. And we just said, okay, you decide your level of comfort and how much information you'd like to disclose. But by the second focus group, which usually takes place 4 to 5 months within the program, we tend to find that there's more information, there's comfort there, there's a sense of community. It's interesting sometimes by the fourth month, someone has, oh, well, my granddaughter. And so really what we make sure we do not do is define what the relationship is to become. There is truly some lasting relationships that have been built through the program, and then there are others who, just personality-wise, they may not fix. It's just you go through the process and the requirements of the program. So we're still learning along those ways. As far as the student experience, the students also take pre and post surveys, and that's more on the attitudes of Parkinson's. And it was a geriatric survey that was already done, and we just tailored it to Parkinson's disease. The students are involved in monthly lecture sessions with Dr. LaFavor, in which they are given information about Parkinson's disease, and that is within the first year of medical school. So it's truly getting information that would not have been received probably until year 3 or so if someone decided to go into the field of neurology. And then they also participate in separate focus groups, again, kind of going along those same processes of deciding, how much information do you think you'll share, what type of relationship, and really what we're trying to gain on the med student side is how much information they're learning about Parkinson's along the way, but then also their feelings of how comfortable the Parkinson's patient is being with them and how open they are. And again, we're trying to manage the isolation. Is it working? Are they giving up more information and sharing those types of things? And so the collaborative learning dynamics, and so now we have to have the environment which we bring the two pairs, the buddy pairs together. So we ask that the pairs meet monthly at a time that's suitable for them, location that's suitable. We provide a stipend of $150, and it's not much, but again, if you want to just do a movie or go to have coffee, that's something that we will reimburse, and so we do that for each of the pairs. We have group gatherings that are hosted by our center, holiday gatherings, anything that we can find where you bring everyone together. And so what we found from the first year going into the second year is that depending on the personality, a one-on-one situation may be a little awkward. And so the more that we can offer a group setting where it may be 2 or 3 buddy pairs or a larger group, people begin to feel more comfortable. And so going into the second year now, we're doing group gatherings a little more sooner and then more frequent in this year. And then structured activities. One of the things that we learned from the focus group, one of our more vocal Parkinson's patients, he said, well, it was about the 5th meeting, and I just finally had to look at my med student and say, are we going to talk about Parkinson's? And then we realized not everyone is comfortable or knows how to address Parkinson's. And so what we did is, and it was really simple this time around, we did a bingo sheet, and we gave it out last month. And when we come back for our holiday party, we'll have games and prizes. And the bingo sheet, basically, we're trying to get the full sheet, whoever can have the most covered or bingo, but it's each box has something related to Parkinson's. Did you discuss what your worst day is like? Did you discuss, how many times do you forget to take your medicine? So those are the types of things that we are finding ways to gently introduce conversations for those who may not get that naturally. So it's a interesting learning process, but again, that's why we're in this. So this is the second year, and so some of the things that I would, as we talk amongst other leaders, I know Eli, she said, well, you should come prepared with how others could implement this. And I said, well, we're still learning how to implement this, so I don't really know. But what I can tell you is from one year to the next, what I would consider. Definitely great program, but there has been a lot of time from my end, which was not really expected. We're a small nonprofit, 3 staff. A lot of our programs are exercise. So if someone does not show up, then it's not a big deal. You just pay the instructor, you try to do more marketing to increase attendance. Because there's so many different stakeholders within this program, as the ED, you really have to have a handle on what's going on. And so for the med student themselves, they get service hours for this. And so if your person with Parkinson's decides 6 months into the program, I just don't want to do this anymore, then your med student is out because by then it's too late. So we really have to manage those relationships, not oversight, but truly just try to make sure that everything is going as smoothly as possible. What I did not realize is that with a lot of our programs in the past, you go to a program, you take a survey, did you like it, what could we do differently? You store that information away, and then you maybe share some quotes with the funder later on. Not with the university. There's a thing called the IRB process, the Institution Review Board, and that requires University of Louisville is a research institution, and there's a lot of testing and process and regulations that you have to meet. And so as an ED, we have a program staff person, and so you figure out who's the best person to go through this process. You don't want to make the doctors mad later on because your staff person decides to go get a job somewhere else and make a little bit more, make a little more money. And so as an ED, I decided that I was the best person to go through that process. I was the most stable. I knew career-wise, I'm not going anywhere. And you don't want to damage those relationships that you have with the hospital systems and the doctors. Did not realize that that was a full course, online course that I would have to take. And then after you take the process, you're the only one that can consent the patients, which is like a 45-minute process of going through all of the rights as a researcher and then surveys. And so those are the things to think about because it's a little more than what your average program is. Again, definitely worth it on the end of training the trainer, but you have to be prepared for it. So funding, I would say that we were in a really unique situation because Dr. LaFavor just so happened to be in that dual role, and her practice as a doctor is under the hospital system of Kentuckiana Health that's also affiliated with the University of Louisville. In any other role, I'm not sure that a hospital system would just allow any funder to come in and sponsor a doctor without it being a big process. And so we really did not go secure new funding. We just found a way to use existing funding and attach a program. And so we can say that, maybe that's a little more stability, that funding won't go away, because now this funder truly has a program and a doctor that it wants to back. But at the same time, when you're looking to implement this, you have to realize that because you're dealing with a doctor and then a university, your funding options are going to have a lot of input from those who are outside of your organization. So just some things to think about, but great program. I wouldn't be doing my service if I didn't come and share all of those things. So the good thing, we have Dr. LaFavor. She's here. She's going to be presenting a poster and doing the poster tours. Also, the researcher, Dr. Denise Cumberland, she is here presenting a poster. So if someone is truly interested in learning more about the program, how to connect with the university, and what the process is to get that started, the people are all here in town, and that would be a great way. In ending, this is a picture of the first graduating class of the Buddy program. And then, so these are the med students, and then also the Parkinson's participants. This was at our holiday party, so, yeah.